How can your neck cause dizziness? The internal mapping theory suggests that it really comes down to mismatch in the movement of your neck versus what your brain expects it to do. If we look at a really common issue I see, like cervical rotation not happening well, it can really help us understand how this kind of thing can happen and also what would need to happen to fix it. So like we talked about on Monday, your neck should rotate around a vertical axis. Something really common to see is rotation happens, but there's also some side bending or some forward flexion or some extension. Basically, you're not getting that pure rotation and you're having something like that happen. So what's going wrong? It really comes down to the idea of intrinsic versus extrinsic cervical rotators. We talked about on Monday that you have all these muscles that just connect within your cervical spine that are designed to cause that nice, pure vertical rotation. But there's also a ton of muscles like your upper traps, your SCM, that attach from your neck to somewhere else. And while they can cause rotation of your neck, they also have other actions. So your SCM, for example, it rotates your neck to the opposite side, but it also does a side bending. So if you look at yourself in the mirror and you realize you're kind of doing this weird thing, or your head's tipping to the side when you rotate, often that's due to a faulty movement pattern. The person who's done the most work and the best work in this area, in my opinion, is Shirley Sarman, and most of these ideas are hers. The beauty of that is it gives you a framework to fixing this. An idea to correct not only the pain, but the quality of the movement. That's a lot of what I do to help people fix their dizziness.